Hi everybody, welcome to this edition of Facebook Live here at Flowers Medical Group. I'm Dr. Lynn Flowers. We are excited to have Dr. Sarah Ballantyne with us today. She is an expert in autoimmune diseases, gut health, and nutrition. And so we're going to talk about the topic today is hypothyroidism, fatigue, and the things that go around with that, and what happens clinically when we do that evaluation, certainly from a functional medicine standpoint. Thyroid is the master gland for metabolism in the body. And we see high thyroid, hyper, or low thyroid, hypo. Today we're going to talk about low thyroid. And the most common reason we get low thyroid actually is a condition called Hashimoto's, which is an autoimmune disease where the body literally attacks the thyroid gland, and then that can cause a whole host of symptoms that go along with that. And Sarah happens to be one of our star patients.
I was going to say.
Years ago, we actually discovered these things with her, even though she had some known issues that she had discovered before with autoimmune disease. We discovered that and some of the issues that were going on at that time.
Yeah, so I was going to say, I'm also a long-time patient of Dr. Flowers, and one of the reasons why I was so excited to jump in on this topic is that it's not only something that I know a lot about because of my books, but it's also my personal experience was exactly Hashimoto's thyroiditis, but also the interface with cortisol secretion and the HPA axis.
Absolutely. So one of the contributors that can go along with changing in thyroid function, and particularly what we see with chronic stress and the stress reaction and adrenal dysfunction, affects the thyroid. And so that's exactly what happened with Sarah initially. Actually, adrenal suppression from chronic stress. It's a functional suppression of the adrenal gland, not a disease of the anatomy of the gland. And that actually masked some of the things that were going on with the thyroid. And once that we addressed that, because we're really approaching this from a standpoint of fatigue in the setting of autoimmune disease. And then, of course, we discovered that as we went along.
Yeah, so it's interesting because there's a lot of crosstalk between the thyroid system, the stress axis, and even reproductive hormones, right? So we have, and insulin.
Yes.
So these systems all interact with each other. And one of the things that can happen is in a disease state, my blood work was a great example, was my flatlined cortisol actually was masking my Hashimoto's thyroiditis. And we weren't able to detect that until we were able to deal with the HPA axis dysfunction first.
Exactly. And that also helped with the fatigue, but then as we're looking at the thyroid, when we're doing testing here, of course, we're looking at the full medical picture. And so this has happened to be one of the focus that arose out of this. And then we're looking at the full thyroid panel. So we really needed to see not just TSH, we needed to see free T3, free T4. We usually look at reverse T3 and then antibodies. And so that's not typical in the conventional setting in medicine today, but we know those are very critical in being able to tease out what's really going on with the thyroid.
So we've also often referred to that as a full thyroid panel, as opposed to what might be typically run during somebody's annual physical. How would a patient advocate for a full thyroid panel?
And that's asking for those things specifically. And so there can be some resistance in the conventional medicine world because they're taught in their standard panels and even their insurance panels involved doing usually a TSH and maybe a T4. And they're many times we're looking at a screen because they're not looking at the details. So functional medicine physicians are really tuned into that. We're also looking at the levels in a different way. We're looking for optimizing that. And we're also keeping in mind how this interplay is happening with the other areas of the endocrine system, including the cortisol. So if I see someone with a marginal thyroid, then it makes me want to look behind that. So is there some other issue with the endocrine system, nutritional? And then if we see antibodies, like with you, we want to know, are there other triggers that are going on? And so that's also related to other types of autoimmune disease. So hence sort of the connection between gut and celiac disease and gluten sensitivity and this Hashimoto's syndrome.
So actually Hashimoto's thyroiditis is the single most common autoimmune disease. It affects an estimated of 1 in 200 people, so it has the highest incidence rate of all autoimmune diseases. But also there's something called subclinical hypothyroidism, which may or may not be linked with antibody production. And that is estimated to affect something like 15 to 20% of people. And that's where your thyroid is not really up to snuff, but it's not so low that your numbers are outside of the lab range. And that's where the functional medicine
that's right. Yeah.
idea of looking at those ranges is very different, right? A functional range is different than the standard lab range.
Right, and it may not come to the awareness, even though the studies that sort of describe subclinical hypothyroidism are in the internal medicine literature. They're not in the integrative medicine literature, but it doesn't go recognized. And so we're also putting together the clinical picture of the patient. So all the symptoms that go along with that, and sometimes they're non-specific. They can be tiredness, it can be maybe some changes in hair, skin, nails, weight, mood changes. There can be some other hormonal changes, menstrual cycle changes.
Brain fog.
Brain fog is another very common
joint
one.
Pain, constipation.
Skin problems that just come and go that no one can.
And secondary autoimmune diseases. So there's a whole class of, for example, psoriasis is very commonly secondary to Hashimoto's thyroiditis. So sometimes someone won't realize they're hypothyroid, but they'll be struggling with psoriasis, and the thyroid is actually the root cause.
Exactly, or some kind of dermatitis that no one can quite figure out, but when we go and look underneath, we can discover those things. So it is a full panel of the thyroid, but it's also looking for the other contributors, the other triggers nutritionally, and then a full medical panel, because if someone has fatigue, you want to look for the common things to make sure that there's not anemia, or there's not some sort of blatant cause that's along with that, which is part of the process for doing that evaluation.
Well, and the symptoms, this was certainly something that I experienced, right? The symptoms of cortisol dysregulation look really similar to the symptoms of hypothyroidism.
That's right.
So why did we do salivary cortisol testing?
So salivary cortisol testing gives us a very precise measure. It's actually an accepted standard for measuring cortisol in lab medicine. But also with salivary, we can actually look at the full curve throughout the day. So we can see what the normal flow of cortisol should be from morning, evening, nighttime. You can get a blood level, but usually it's a point in time. The standards for all the studies were actually done at one time in the morning, but you don't always get that exact time in the morning. And like with you can't really tell what's happening the rest of the day. That doesn't give you all the information you need.
I think one of the things that's really frustrating for patients too is that high cortisol can feel exactly the same as low cortisol. Symptom-wise, you can't really differentiate. You can't say, oh, my cortisol must be too high or my cortisol must be too low, or it's too low in the morning but too high in the afternoon. All of those things feel so similar. You can't really figure out a treatment protocol without the actual data in front of you of exactly what cortisol is doing throughout the day.
Yes, very important, because in the way we treat this is we're looking at, obviously we do it from a stress control technique, and we're helping the people to learn how to control their stress, but we have some natural ways that help the body to recover, to support adrenal function. The body actually has a higher nutrient requirement when there's adrenal dysfunction, and so we need to address that as well. And then treating the thyroid. So once we discovered that, there are lots of ways to treat the thyroid. It's very individual. And we need to do that based on clinical presentation, response, but then also lab. So the lab gives us a good idea. We're in the range, and we're individualizing therapy. So it could be done with some standard medications, some prescription medications, more natural medications, and then we need to combine that to make sure that the essential cofactors are there to support that. Functional medicine, we want those in optimal ranges, and so T3 is very important. T3 is the most active and vital part of thyroid in the body, but you need a good balance of that. You need T4 for normal brain function, so T4 has got to be normal as well, because it's got to go into the brain and then converts to T3, whereas the rest of the body needs to have conversion for active T3.
So I think that's one of the most common questions that I get asked is, what is the best thyroid hormone replacement for me? And I think it's a very frustrating answer to hear of, well, it depends. There isn't one particular formula that is going to work well for everybody. But it might be helpful to sort of explain a little bit of the huge amount of tinkering that we've done with my thyroid hormone. I think I'm on my fourth formulation.
Mm-hmm.
We've really been testing about every 6 weeks and adjusting the dose.
Mm-hmm.
We get to a really high dose, we sort of hit the most that we can do with that particular formula. We switch to a different option, and we finally have figured out I'm a terrible T4 to T3 converter, and I really need a lot more T3 than most of these sort of standard, something like Armour or Nature Thyroid would provide, and that has been critical for me.
Right.
But what is it about? What are you looking for to decide it's time to change?
So it is a response, but again, it goes back to that T3. If we're giving more of a T3 product, or something like a natural thyroid or Armour or Nature Thyroid, it's a fixed ratio. And so that works for a lot of people, but if you're not a good converter, I also go back and look at the adrenals, right? Because that's why we have to go incrementally, because your adrenal response is going to change with that. And then it could also change over time, so periodically we will check levels. So fixed ratios are fine for some people. If they're a very good converter, or someone comes and their levels look really good on a T4 medication, then that may be okay. That may be their dose. We can add in a T3, and then commonly, like what we're doing with you, we can compound it. So oftentimes, just by the patients that we see, we get into a very specific individualized ratio and do compounding for that.
So we have been very closely monitoring my thyroid and my adrenals over time, and we've talked a little bit about treatment protocols for thyroid, but not very much about treatment protocols for adrenals. And so I'd love to hear you introduce the concept of adaptogens.
Yes, so we commonly use compounds called adaptogens. These are natural products, usually botanical products that have been used for centuries. And it's interesting to see the research now that we can understand actually how these are working in the body. And so as the name kind of talks about, it helps you to adapt to stress. It's helping to modulate the adrenal function to respond to a stress reaction. And then the other things that we use is actually to make sure when we're having chronic stress reaction as well. We're trying to help normalize your cortisol response. So cortisol is actually required. We die without it, but it needs to be in a controlled release throughout the day. Too much, it actually it's catabolic. It's not good for us. If it's too little, then you're very fatigued, you're flatline, and all that influences how the thyroid works. So there are lots of these different compounds, and depending on, again, what your pattern is, what are your levels? We've got to know your levels. Symptoms tell us a lot, but they don't always tell the whole story, and so that helps us to put together those pieces about what to use. Some of them are ones that people like and can stay on, they feel good, they're supportive ones. Other ones have a higher sort of treatment value that I wouldn't leave someone on an adaptogen forever. And so as they go through the phases and they start to recover, then this has to be adjusted as we go.
So I've been really, really fortunate in my health journey to find you. I really have become an extreme advocate for the functional medicine model because of my experience here. Dr. Flowers has just he's been able to take everything that I do diet and lifestyle wise to support my health and been able to take it to the next level. And in many cases, address something going on in my body that was the reason why my body wasn't responding to the good choices that I was making, so that I'm actually getting sort of more bang for my buck by choosing good foods and working out and sleeping. So functional medicine is obviously an amazing resource, and for anybody who's lucky enough to live within driving distance of the Atlanta area, they can come see you.
Oh, absolutely. We'd love to have you.
But for people who don't live here, how do you recommend people find your type of approach?
Right. So there's some groups in the country that are training physicians, and so that's the first place to look. Look for a physician that has gone through the fellowship training program. I trained through the American Academy of Anti-Aging and Regenerative Medicine, now it's the Metabolic Medical Institute, as well as George Washington University, so about to finish the integrative medicine program there. So when you look at someone's credentials, you want to make sure that they have training and they're credentialed to do that. And the other big group is the Institute for Functional Medicine. So they have a great training program as well to try to find doctors that are trained in this kind of medicine. It's not just what we prescribe, it's how we do this. and the approach that we take that's got to be collaborative for you.
Yeah, I really think that functional medicine is the future of medicine, right? It's not just the future of interventional care, but also preventative care.
Exactly. We call this interventional preventive medicine. Another exciting thing is that when we take this approach and Sarah is better and learning about all these things, then she gets so excited she goes and writes a book about each of these things. And so you actually have a new book that's coming soon.
I have a new book that's coming soon, but my old book is actually my fourth one. My most recent one is probably the best starting point for people who are looking for answers in terms of the diet and lifestyle aspects that will help support healing. So one of the things about a functional approach is diet and lifestyle becomes integrated into everything else that is done, because you cannot use medications and adaptogens to out supplement a bad diet.
Right.
So that book is called Paleo Principles. It's really just based on the medical literature, and it happens to fall under the same template as a paleo diet, but it's based on what the medical literature tells us are the optimal choices for health. And it's available everywhere bookstores books are sold.
Very good. Highly recommend it. Thanks everyone for coming today. And if you have questions or comments, please post them, and look forward to hearing from you.